Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. What to do if you missed a birth control pill? It is possible to get pregnant if you missed a pill and had unprotected sex. The risk depends on your medication, how many active, hormone-containing pills you missed, and how long it has been since your last dose. /r/n/r/n If you miss a pill, take it as soon as you remember. Keep taking your pills according to your usual schedule. If it has been more than 48 hours since your last dose, you will need to use backup birth control. If you had unprotected sex in the 5 days before you resumed taking your pills, it is a good idea to use emergency contraception. /r/n/r/n This article discusses the likelihood of pregnancy after forgetting to take birth control pills one or more times in a cycle. It also details how timing and other things can interfere with the pill's effectiveness. /r/n/r/n Illustration by Danie Drankwalter for Verywell Health /r/n/r/n Missing one pill may not increase your risk of pregnancy, depending on what type of pill you take. /r/n/r/n Planned Parenthood has a handy quiz you can take to figure out what to do in your specific situation, but here's a review of the general guidelines. /r/n/r/n One Late or Missed Combination Pill /r/n/r/n If it's been 24 to 48 hours since your last dose, /r/n/r/n Backup birth control may include condoms, diaphragms, or sponges. /r/n/r/n 2 or more missed combination pills /r/n/r/n If it has been 48 hours or more since your last dose, /r/n/r/n One Late ProgestinOnly Pill /r/n/r/n If it's been more than 3 hours since your last pill but less than a day, /r/n/r/n One Missed ProgestinOnly Pill /r/n/r/n If you missed an entire day, /r/n/r/n Call your healthcare provider's office if you are unsure how to proceed or need further assistance. You can also check your birth control package insert for more information. /r/n/r/n The pill is 99% effective in people who take their pill on time every day. The percentage drops to 91% in people who do not adhere to a consistent daily schedule. /r/n/r/n Many birth control pill packs have 3 weeks of active pills that contain either progestin and estrogen, combination pills, or only progestin. They also have 1 week of placebos, which are sugar pills that have no hormones. /r/n/r/n With these packs, forgetting to take a pill if it's your first, second, or third week can affect your pregnancy risk. Forgetting to take a placebo pill does not affect your pregnancy risk, as these pills are only there to help you remember to take a pill each day. /r/n/r/n There are also packs with 24 active pills and 4 placebos or 84 active pills and 7 placebos. You can determine whether a missed pill is a concern by applying the same knowledge a missed active pill affects your risk. Missing a placebo pill doesn't. /r/n/r/n If you miss more than 1 dose per pill pack, the risk of pregnancy jumps. /r/n/r/n The birth control pill is not 100% effective even when taken perfectly. To achieve the best results, you need to take the pill at the same time every day. Missing or delaying doses allows the therapeutic drug level to drop. /r/n/r/n Ultimately, there is a point at which drug levels drop low enough that ovulation can occur. This can happen more quickly in some people than others, and the drop is faster with the progestin-only minipill use versus combination pill use. /r/n/r/n The 2 most common side effects of missing a birth control pill are spotting and pregnancy. /r/n/r/n Vomiting or diarrhea can also lessen the pill's effects because too much active drug may be eliminated from the body. The effect can be similar to forgetting to take the pill altogether. /r/n/r/n oral contraceptives provide your body with just enough hormones to block ovulation. Ovulation, when an egg is released from the ovaries, usually occurs between day 11 and day 21 of the menstrual cycle. People are most fertile during the 2 to 3 days before ovulation. /r/n/r/n When you take your birth control pills as prescribed, your body will have a steady supply of medication to keep you from ovulating. This is referred to as maintaining the therapeutic drug level, or how much of the drug needs to be in your system to be effective. /r/n/r/n Try to identify why you missed your dose. /r/n/r/n If you frequently miss pills, you might consider a long-acting reversible contraception, LARC, such as an intrauterine device, IUD, or hormonal implant. /r/n/r/n Copper IUDs do not contain hormones and can stay in place for up to 10 years. Hormone-releasing IUDs can be left in place for up to 5 years. Implants, such as Implanon and Nexplanon, use hormones and are placed in the upper arm. They are effective for 3 years. /r/n/r/n By pinpointing the cause, you can take steps to avoid missing a pill in the future. For example, /r/n/r/n neuroscientists who study habit formation recommend tying habits together, such as taking your birth control pill right after you brush your teeth. /r/n/r/n This technique, known as habit stacking or habit chaining, has been shown to increase the likelihood that a new habit will stick. /r/n/r/n If you miss your birth control pill often, talk to your healthcare provider about an alternate contraception that does not need to be taken daily. For example, you may want to consider using a birth control patch or IUD. /r/n/r/n You should also see your healthcare provider if you have had a positive pregnancy test, or if you have any early signs of pregnancy, such as /r/n/r/n If you missed a pill and had unprotected sex before realizing you missed a pill, you might consider using emergency contraception. The most common forms of emergency contraception are the copper IUD or the morning after pill. /r/n/r/n Many people wonder whether emergency contraception can cause an abortion if pregnancy has already occurred. Emergency contraceptive pills will not be effective if implantation of a fertilized egg has occurred. They cannot cause abortion. Copper IUDs are only implanted if a high-sensitivity pregnancy test is negative. /r/n/r/n The most effective emergency contraception is insertion of a copper intrauterine device, IUD. It is effective up to 5 days after unprotected sex. It involves a healthcare provider inserting a T-shaped copper device into the uterus. /r/n/r/n The IUD will prevent pregnancy with more than 99% effectiveness. It can be inserted up to 5 days after unprotected sex, although some studies suggest it can be inserted even later, as long as high-sensitivity pregnancy tests are negative. /r/n/r/n Emergency contraception pills are another option. They are commonly called the morning after pill. There are 2 main types of morning after pills. /r/n/r/n Taking birth control every day, at the same time each day, is the best way to prevent pregnancy. A steady supply of hormones will keep you from ovulating. However, don't panic if you forget. You may still have some level of protection. /r/n/r/n Be sure to resume your birth control according to the specific instructions for your medication. /r/n/r/n If you had unprotected sex and want to prevent pregnancy, you may want to consider using emergency contraception. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.